October 28th. Okay. Tomorrow. So a year ago tonight, I was at the hospital. Yeah. Because you didn't want to be born on Halloween. Well, that's not why you didn't use me, but I was like, oh my gosh, I can't have a kid born on Halloween. Like, that's guaranteed alcohol poisoning on their 21st birthday. Like, if your birthday is on Halloween and you're in college, like, she's never going to survive it. But then Teddy so affectionately told me that, like, it doesn't matter when your birthday is, you're going to risk dying of alcohol poisoning to get in college. So thank you for that. I really needed that.
Much appreciated.
Alrighty, guys. So we're going to spend today's class talking about after labor and delivery, and that fourth trimester. Has everyone heard of the fourth trimester? Okay, so what it's described, if you haven't heard of it, what it's described as, we've got the audio on here too, which should be good. If you'll just hit the arrow. Yeah, everyone we switch to it. So the fourth trimester is the 12 weeks following labor and delivery. It's the time where baby doesn't know that they're a separate entity from mom. And so, so doing things both for your own body and for baby to promote that growth can really help make life a lot easier for the both of you. So the American College of Obstetrics and Gynecology defines this fourth trimester as those weeks following birth, and they're a critical period, especially for women and for infants, setting the stage for long-term health and well-being. This is the time, like Megan and I were saying a couple classes ago, if you can get through those first 6 weeks, like, you're going to be just fine. And you will get through those first 6 weeks, right? Like, there's not really an option. You're going to make it through the first 6 weeks.
It may not be pretty, but
and that's okay. But postpartum is really ongoing. I mean, once you've had a baby, you could be 50 years postpartum. I used to work with some women's health fitness instructors, and they described everyone postpartum from like 5 days to 50 years. Like, your body is now forever different because you carried this baby. And that it's going to affect your care as a whole, so future pregnancies, recovery from any complications that may be happening or happen during birth, and then also in terms of preventing future pregnancies, so contraception as well. So the initial follow-up from delivery should be within the first 3 postpartum weeks. If you live in a big city and you are delivering your baby at a hospital that delivers 75 babies a day as opposed to 75 babies a year, which we do here, so you deliver, you maybe spend 24 hours in the hospital, and they're like, all right, go care for this small human. We'll see you in 6 weeks. Like, there's 0 follow-up care for 6 weeks. What's really awesome here is that your OB is also likely your pediatrician. So you are going to have a 3-day checkup and a 2-week checkup and a 1-month checkup, and then finally you get to your 6-week visit. And so those are times where you can go in and talk to your OB and say, hey, this is happening or that is happening. Is this normal? And deal with things like postpartum anxiety and depression or significant pain or significant bleeding. Those are all things that are great to bring up. Another thing that we do, especially as mothers, is we have a tendency to forget everything about ourselves and focus on our baby. And your babies are born during cold and flu season, and so the first time your baby gets a cold, it's going to be traumatic for everybody. And it's important to not forget yourself in that equation too, right? Like, getting your baby through cold and flu season is very important, but also is getting yourself through these first 12 weeks. The American College of Obstetrics and Gynecology also recommend a 12-week visit, and this is not something that normally occurs in our American culture or a standard postpartum care, but it's absolutely something that you can have with your doc here. Those visits should include a discussion of physical, social, and psychological well-being. Like, I know when I came in at 2 months for our 2-month checkup with Dr. Gallagher, he was like, okay, how are you sleeping? Like, that was one of the first questions he asked me, even though we were there for my daughter. So it's a really great thing that our docs do. They're looking at you as a whole, really, like the two of you as a whole in that the fourth trimester. And God forbid, but even an experience of miscarriage or stillbirth, which unfortunately happen, those are still things that should have follow-up care, right? So if you experience something very traumatic in your delivery and you don't go home with a baby, it's still very important to follow up with care. And we don't always do a good job of that, right? Like, we struggle with how to deal with grief. And sometimes the grief isn't because you or your baby died. Sometimes your grief is because you lost that birth experience that you thought you were going to have, or you had a birth experience that was different than what you thought it was going to be. Both of those things, absolutely not to minimize, the death of a newborn or the death of a parent, but those are things that can create trauma and can create grief as well. And so, these are things to discuss. I know we're starting off tonight super heavy, but it's really important, because there are things, it is not trivial if you feel like your birth was traumatic. That is not trivial, and that will stick with you. And you'll hear stories of really horrible things that happen to other people. That does not mean that your experience was not traumatic in your body. So it's very important that you make sure you get the right attention that you need to recover from that. And maybe that's medical, or maybe that's more making sure you take time for yourself and you eat well and drink lots of water and just do all the well-being things for yourself. But whatever your experience is, make sure you take care of you, because you have to take care of a tiny human. So the most important thing I can do, and probably the hardest thing to do, is rest. There is real legit sleep deprivation in those first few weeks, especially in the first few days. Like we were talking, maybe you labor for 48 hours and you slept a couple hours in 48 hours, and then, I know with the birth of my daughter, I was having trouble getting my bladder starting to work again, so I had to be catheterized multiple times that first 24 hours, those first 12 hours after she was born, which are these golden, peaceful, blissful hours where she's sleeping, and I didn't get to sleep, and that was rough for about the next week. So we talk about resting in the hospital. Thank goodness for delivering in a time of a pandemic, because nobody could be here with you. And if it's great, please sleep as much as you can. And then when you get home, have yourself set up with friends and family members. And this can be very, very difficult, especially as a first-time parent, because you aren't quite sure if you can do it. And so asking for lots of help without really knowing what you need help for is just challenging. I mean, you just aren't quite sure what to help for, or what to ask for help. But all those people who say, can we bring you food? Can we come do this for you? Can we come do that for you? Just get their phone number, and especially partners, get their phone number, and then when it's 3 o'clock in the morning and everybody is crying, you're going to be like, you know what, at 9 o'clock I'm going to call that person, whatever it was, whatever it is we need, I'm going to have them do that for us. And don't, people love to do things, right? And especially now when people have been so isolated for so long, if they get an opportunity to cook you a meal and bring it over and then take out your garbage for you, people are really going to love to do that. And even not in a time of a pandemic, people like doing that too. Stay hydrated. So we talked about last time in breastfeeding, you're looking at 90 to 120 ounces of water a day. That's almost a gallon of water a day, and it will be easy with breastfeeding, especially after your milk comes in those first early times. It's very easy to get dehydrated. If you haven't been drinking coffee and now you're not sleeping, you're going to be praise Jesus for coffee. And that's okay, but then make sure you hit that with water too. Coffee isn't as dehydrating as we used to think it was. We used to think it completely negates any water you drink, but we've actually found is it's perfectly hydrating. It's similar, maybe a little less than water in terms of hydration, but it makes you pee more, so that dehydrates you. So making sure, if you do drink coffee, some people even, and I don't know what the incidence is on this, and Megan can speak more to this, but some people even find they drink coffee and then it's irritating to their baby that they breastfeed later. So I don't know what the actual statistical significance.
The amount of, because anytime you eat or drink something, it gets filtered through your liver, and then all the lactocytes, the cells in your breast, filter it again. So the passage of, the amount of caffeine that's actually getting through your liver and then through your lactocytes to the baby is actually fairly minimal. And so most of the breastfeeding literature says that food actually isn't as irritating to our babies as we kind of once thought that it was. So it's really common for babies to 0 to 3 or 3 weeks to 3 months. They can be really fussy and irritable. And I think historically we all chalked that up to colic, and we all talked about how colicky our baby was. But really, from 2 weeks to 3 months, a lot of babies are really fussy. And so I feel like that's when breastfeeding moms start going on this elimination diet where they cut out caffeine, and then they cut out chocolate, and then they cut out lactose, and then they cut out all these things. And they finally get to 3-month mark, and they're like, whew, like I finally figured out what was causing all of our problems, right? And they're like down to eating like celery and water. Like that's the only things they can eat. And it's like, no, actually, really, your baby is just 3 months old, and they've grown out of that phase, and it has nothing to do with all the things that you eliminated from your diet, because formula-fed families are exactly the same, right? Like they're like, oh, like this formula didn't work, so then right? And if you talk to formula families, they say the same thing, like, oh, we started that formula and they were really fussy, and so we switched to this other kind, and they were really fussy, and we switched to this other kind, and they were really fussy, and we finally found this one brand, it's only on the bottom shelf at Target on Tuesdays, like that's the formula that they can tolerate, and really, they're just 3 months old now, and they're not fussy all the time. And so I think sometimes you can make yourself crazy with like, you know, how much you try to eliminate from your diet or whatnot. Like babies are just fussy for the first 3 months because they think they're still supposed to be in your belly, and so they're not, and that's irritating. So, I mean, I try not to be too crazy, like, about what I put into my body, and you know what I mean, like, I mean, the amount that's going to get to your baby is fairly minimal. Dr. Gallagher always says, like, do you drink chocolate milk? Like, does your milk come out as chocolate milk? Like, no. So, you know, like, how much chocolate really goes from you through your digestive system, through your liver, through your lactocytes, to your breast milk? Like, very little. Which, you know, is simplifying it a lot. But I think you know, there are few cases where it's like babies do have like a true allergy. So we actually saw a baby here that had a true allergy to milk protein. And so it's not that she's allergic to breast milk, it's that if mom eats lactose, the milk protein from the cow's milk, she gets trace amounts of it in her breast milk, and she's allergic to that. And so mom cut out, I mean, but she was having like a significant amount of frank blood in her diaper, like multiple times a day, just bloody red diapers. And so mom cut out lactose, and her diapers completely cleared up. So, I mean, that's the case where it's like, okay, yes, like she has a true allergy to milk protein, not to breast milk, and you know, but for the most part, babies are fussy from 3 weeks to 3 months, and you get past 3 months, and it's a lot better.
And you really got to do what makes you, like, what
Right.
keeps you safe, right? So, I, like, a girlfriend of mine, she was exclusively pumping, and she was like, you know, it's fussy, like, that first bottle after I've had, and I think she had, like, half a cup of coffee. Like, this gal is not a coffee drinker, but she had you guys will watch a video about purple crying babies. And they had a purple crier. Like, she's the only person I think I've ever met who's, like, legit had a purple crying baby. And so she was exclusively pumping, and then that first pump right after she had a cup of coffee in the morning, she was like any fussy. So she had this whole system of like mixing all of her milk together and diluting caffeine. But, you know, to really do what helps you feel sane and what you feel like works, but try not to make yourself crazy.
Yeah.
That being said about, you know, breast milk and what gets into it, it might be good to touch on, like, you know, if you consume alcohol, if you smoke marijuana, things like that, because trace amounts do get through the breast milk. Like there are some, I mean, you can.
So as far as alcohol goes, I mean, they say if you're just going to have like 1 glass of wine or 1 beer, then it would be fine to breastfeed after that. But your blood alcohol and the amount of alcohol in your breast milk like follow the same curve, right? So like it would be best to nurse and then drink your glass of wine and then eat dinner and then nurse again, as opposed to like drink your glass of wine and nurse right then. Does that make sense? Like, so that curve is the same curve because your breasts are so vascularized, and there's so much blood flow going to your breast if you're breastfeeding that it's like that blood is just circulating through your body. And so the peak of your blood alcohol concentration is also going to be the peak of the alcohol concentration in your milk, even though it's going to be significantly lower than it would be in your bloodstream. So that's kind of the recommendation, like nurse before and nurse after, right? But if you're going to go out and like, my gosh, it's my 30th birthday and I'm going to party all night long, like, then you should pump and dump, you know, until like the next morning and then go back to nursing your baby. Marijuana is probably like the one of the things that you really want to avoid if you're breastfeeding, because the marijuana is like fat soluble, I guess, like it is absorbed well into fat, and your breast milk is like has a lot of fat in it, and so your concentration of marijuana in your milk is 5 to 7 times higher than the concentration of marijuana in your bloodstream. So that's like the one thing that they say, like, if you're going to breastfeed, don't use marijuana. And that's like a pretty firm recommendation, I guess.
And in general, fat-soluble things are, like, you don't eliminate them the same way you do, like, they'll store in fatty tissues. So you'll want to, be careful about anything that's fat-soluble that could, fat-soluble that could be affected. Yep. Questions about that? Okay. Yeah, I think it's good to know.
Yeah,
super interesting. There's a really good website I listed at the end. It's called, we have Megan, of course, but if Megan's not available or you need, like, you're wanting to read stuff right now, there's a website called kellymom.com, and there's all sorts of evidence-based breastfeeding research, and all sorts of questions that people pose. So that, I would recommend that as a website. Just if you have questions about breastfeeding or, like, you know, how should I store my milk, or how long is milk good for in the fridge, yada, yada, yada. It's got some good recommendations. Or if you have a baby from the NICU, you know, what are the recommendations for NICU babies versus like full-term babies? But back to your body, back to your physical body. So following recovery precautions, after giving birth, there are recovery weight limits, or lifting weight limits. So if you have a C-section, you don't want to be lifting anything heavier than your baby for about 8 weeks, usually 6 to 8 weeks. So it's quite a while. You know, so if you have a 5-pound baby, you shouldn't be lifting a gallon of milk. A gallon of milk weighs 7 pounds. Just for comparison. Activity limitations. So you will not feel like it, nor probably have time. But like if you're a runner, or if you are a heavy exerciser, that will probably not feel good right away. If you need exercise to clear your brain, I would recommend picking something more core stabilization, so less high impact things like running or HIIT training or jumping, anything where like you're creating impact, kind of like what we talked about during pregnancy, but like a Pilates or a yoga that isn't like really deep stretching, core stability focus. Those are really good exercises to go to. Walking is also fantastic. I had a mentor during my residency who said that humans can outwalk any animal on the planet. Like our bodies are 100% designed for walking, and our evolutionary like development behind walking is just incredible. And if you're interested, I can totally PT nerd out on it at the end of class. But walking is incredible for the body.
I'm surprised that I've never heard you say this.
Oh, really? Oh, yeah. Okay, we'll talk about it again. So intimacy limitations. So there is a recommendation, even if you have a C-section, like no return to intercourse for at least 6 weeks. And this is, as a pelvic floor PT, this is one of my favorite things to talk about because you just pushed a, 12-pound baby out of your vagina, right? And then they're like, 6 weeks, good to go. Nobody looks at your vagina. Nobody like makes sure it's all okay down, unless you say like, hey, somebody needs to look. Like at 6 weeks, they're like, well, you're good to go. And those recommendations are based on the amount of time that it takes your uterus to get back to normal, like how long it takes for your cervix to close back up, right? Because we want your uterus to be this sterile, like sealed off environment.
Ready for the next one.
Ready for the next one. Irish twins, here we go. So at 6 weeks, it is not uncommon, it's not uncommon that you walk in for your 6 week checkup and they're like, okay, you're still bleeding, here's a couple of questions, and really kind of regardless of how you answer those questions, in my personal experience, the recommendations are different, but in my personal experience, they're like, well, yeah, good to go. Now those still apply even if you have a C-section. And some of that has to do with the fact that you just had a major abdominal surgery, and so, like, same thing, like, we're looking at healing scar tissue, uterus, going back to the size it's supposed to be. So be prepared for that. It's usually 6 weeks following a vaginal delivery, 8 weeks following a C-section, but usually by the time you go in for your 6 week visit, as long as you're not experiencing any bleeding and don't have significant pain just with daily activities, they'll tell you to go ahead and go on back. You may also have medications too. So you may have pain meds, you may have like anxiety medications, depression medications for, they would call it the baby blues, which I feel like totally diminishes the seriousness of postpartum anxiety and depression. Like, it is not the baby, it is the baby blues. It is the baby blues because your brain is fighting against this hormonal cascade. So it does have directly to do with pregnancy, but postpartum anxiety and depression can be very serious. And it can be subtle, right? Like, we always, like, they will tell you in these videos that you have to watch before you can leave the hospital, like, if you ever think of hurting your baby, like, tell somebody. Well, it doesn't have to be as serious as thinking of hurting your baby. Like, if you are having difficulty and you are really struggling and you are very stressed out, that is something to bring up with your provider. All right, so vaginal delivery, lifting nothing heavier than your infant for 6 weeks, because same thing, when that baby is gone from there, I wish I had a picture. They have them all over the internet. Like, people are like, okay, 1 day postpartum, right? We already talked about this. Don't bring your pre-pregnancy genes. You will not fit. You will still look about 7 months pregnant. And that is because your abs, like, right, your uterus is still huge. And your abs are starting to knit back together. So one of the things you'll notice is if you're laying in bed and you go to sit straight up, you'll see either one or two things, like your stomach pokes up, like in this little, like, I had a patient who called it a shark fin, like pokes up in this little shark fin, or you'll notice that there's like this gap, and that's called a diastasis recti. And there's all sorts of exercises you can watch all over the internet. It's a problem if it doesn't completely knit back together. Most women, especially multiparous women, so women who have had multiple children, have a little bit of a diastasis somewhere. Like, I have one right by my belly. The belly button is the most common place. So, like, a lot of women will continue to have it right by their belly button. As long as it's not dysfunctional, like as long as you can coordinate your abs well, you're not experiencing any pain, you don't have any back pain, that can be normal. But that's why we want you to wait to lift anything heavier than your infant. Something to think about is like car seats. Car seats weigh, like those infant car seats can be like 10 to 15 pounds. So
unless the child in it is like 25 pounds. So that's
well, yeah, well, no,
heavy.
The car seats themselves can be like 10 to 15 pounds. Yeah, I think I weighed mine and it was 11. And then I had the 6-pound baby, so I was lifting 17 pounds. So that's definitely something to think about. I remember Dr. Gallagher got after me for carrying my daughter in, like, for a 3-day visit. He's like, "What are you doing?" And I was like, I know how to activate my abs, right? I'm a PT. I like paid for it later that day. I was like, oh, they were not ready to start lifting 17 pounds yet. So partners, great thing to do. That person that says, "Hey, is there anything I can help you with?" You can be like, "Yep, can you carry this baby out to the car for me, please?" in their heavy car seat. And the other thing you could think about doing is having the car seat in the car already in there, and then you like lift the baby up and put them in. So that's something to think about as well. We'll give you a peri bottle here at the hospital for perinatal hygiene. It looks like a soap bottle, like a dish soap bottle. So it has a little pop top on the top, and then you spray it. What that's for is immediately after delivery, you're not going to want to be wiping your vagina a bunch, right? Like, so after you pee or after you have a bowel movement and you go to wipe with toilet paper, you won't be wanting to do that. Number one, that tissue has just been like overstretched. You may have incisions. You may have tears, right? So we don't want to get like the fibers from tissue paper in there. So we'll give you a peri bottle, and after you pee, then you'll just rinse with the peri bottle.
What it actually looks like is, if you've ever watched a football game, there's always like the, little like water boy or girl on the sidelines that's like squirting Gatorade in your football helmet too, So I pulled out the peri bottle for this one gal that I delivered, and I said, "Hey, I got this. I'm gonna put it in the bathroom for you." And she goes, aren't you a little late with that? And I was like, huh? Like, she had just had her baby. And she's like, isn't that so you can, like, spray me down with water and give me a drink while I'm pushing? Like, oh. Well, I guess you could use it for that, but that's not typically what it's used for. So it looks like, in my opinion, it looks like a miniature, like, Gatorade bottle, water bottle that you see on the sidelines of a football game.
So, and you may, like, they make some on the internet. So ours are straight, right? So just like Megan said, looks exactly like a water bottle. You can get them online. I think like Frida, like the Frida baby line, they make one that has like a little curve. So you can like, if you picture anatomy, like you can stand and then it like squirts this way as opposed to like having to get underneath or squirt from the top. I don't know. I think about the body mechanics of like trying to like get your hand in the toilet or I guess you could crouch too, but I'm not much of a croucher. Anyway,
it doesn't seem like it's that hard after you push the baby out to maneuver a water bottle.
After a C-section, it is a little harder to like come all the way down. Anyway, so that's getting a little in the weeds. So if you have problems, look on Amazon. There are different styles. The other piece, rinsing your perineum thoroughly with water during the shower. So perineum is the area between vagina and rectum, right? So that is an area, that's where majority of tear, if tear is going to happen, that's where the majority of them happen. So no soap, no douches, no, like, anything that you wouldn't put in your eye, don't put it on your vagina, right? So unless you would squirt it directly in your eye, don't put it on your vagina. And then don't use anything to scrub. This will not be hard to convince you of the first few days, but, you know, as we're talking like 10, 11, 12 weeks out, same difference, right? So there's a normal bacterial flora and fauna that needs to be reestablished at your vagina. Soap deteriorates that, so soap will actually break down the normal healthy bacteria to help keep your vagina like smelling good and not cracked and dry. So just rinsing thoroughly with water from here on out is fantastic. No straining, so we will give you stool softeners here in the hospital. That is another piece that's really, really, so it's kind of crazy because you get a stool softener and probably pain meds, like a narcotic pain medication.
Most of them do not. So after delivery, vaginal and C-section, you're going to get Tylenol scheduled every 6 hours, and then ibuprofen as needed, which I think a lot of times for most moms remember that uterus is cramping to like shrink back down to a normal size, and that feels a lot like period cramps. And so I think for most women, ibuprofen is the most beneficial medication for that crampy sensation. And then if you need additional pain medication on top of that, we would have oxycodone, but I would say very rarely does a vaginal delivery use oxycodone, and fairly infrequently does a C-section use it, which is pretty nice.
So we'll say in the case, especially if you have a narcotic afterwards, definitely, because what a narcotic does is it'll slow your guts down. So people become more constipated, like you actually get a slowing of stool. Does not everybody like to talk about poop as much as I do? Because I clearly love talking about guts and poop. So stop me if we're getting like too in depth.
She has this chart of like, she tells us it's her favorite chart in the whole wide world, and it's just a chart of poop.
Yep, all the different kinds of poop.
Is it in there?
Oh, it really is.
I don't know how it got out.
I know. I'll draw it on the board up here before we leave. Yeah, so making sure you're not straining, right? The other thing that happens after both the vaginal and the cesarean delivery is that like everything's like red and swollen and raw. And so the thought of like you just push the baby out. So even though stool is obviously much smaller, like the thought of anything moving through your perineum can be really painful. Or even like with a C-section, even moving through lower abdomen, like everything that has just been stitched back together now, like moving through, right? It can be really painful. So keeping your stool soft is important. Like I said, we'll have stool softeners here. That hydration piece is really important. And then also just making sure you get lots of fiber in your diet.
I had one gal that came in, delivered a baby, tore, and so the doctor stitched her back up. And so then she went home. She didn't take her stool softener. She got constipated, but like maybe just as much as being constipated, she was just like terrified to poop. Mm-hmm. And so then she went back to the doctor for the 3-day weight and color check with baby, and she insisted that the doctor sewed up the wrong hole. And so she was like
like made him get down there and look, and he was like, no, I'm quite sure that I did not sew your rectum shut, like you're just constipated and scared to poop. But it's like a lot of women are super scared to poop after they deliver, but she was like so terrified, she was convinced that he had actually sewn up the wrong hole. So I don't think that will happen to you, but take your stool softener.
Yes, start there, and if that doesn't work, then definitely bring it up with you back. So, and with that, right, so the slow return to intercourse, if you go back to intercourse at 6 weeks, right, if it's painful, okay, right, like it's been 6 weeks, your hormones are all wonky, so you may like have some vaginal dryness, like the prolactin decreases, like your estrogen and progesterone levels coming out of pregnancy, and then also breastfeeding are going to be kind of funky, so it's going to change the way your vagina feels, and like most women experience like decrease in arousal, decreased libido, increased vaginal dryness. It's lovely. But if it's still painful after 8 weeks, ask for a referral to come see me, because it should not be painful, right? And even there are some things you can do, like in terms of libido and arousal too, especially if you've had any trauma, like physical trauma, any tearing or anything like that. That's something that we can fix really quickly. I don't know if I've told the story in this class, but I once had a woman who, for 18 months after her baby was born, still hadn't been able to have intercourse, and they tried it like numerous times, and I think by the time she saw me, they hadn't even tried in the last 6 months, because it was like 12 out of 10 pain every single time they tried, and she had a perineal tear, then also tore up through her labia minora, so it was probably like if you're looking at a vagina, it was like at 10 o'clock, and I looked at it, and it wasn't a very big tear, but like if she was sitting, it would be painful. If she was sitting with a pair of jeans on, it would be painful, and she'd have to stand. Like she could barely tolerate any touching to it. So mind you, this is 18 months past the birth of her child. I treated her for 3 weeks, and she like complete return to intercourse, right? So, and she was like, oh my God, why did I wait this long? And her doc had said that, well, have you thought about pelvic floor PT? And she was like, no, I don't need that. So it can be fixed really, really quickly. So make sure that if you still have pain after 8 weeks, come see me, right? Like we'll get you back to normal. The other thing to avoid is deep squatting and stretching. That just has a lot to do with those millimeters of movement that we were talking your pelvis has. Your joints have not caught up to the fact that you are not pregnant anymore, right? So like they're like growing, like stretching, trying to keep up with this baby growing really fast, and all of a sudden one day it stops. So like your pelvis kind of comes to this slow grinding halt. So, really, really deep stretching, pigeon stretches. Like I said, with yoga, don't pick really hip opening types of things, more core stability. Again, try not to do any big deep squatting or any sort of end range of motion where you're like really cramped into a position. Any questions on that?
Back to the intercourse, Dr. Gallagher always says, what are the 3 things that couples fight about? Money, sex, and family. And so he said, like, all the hormones after you deliver basically tell your body, like, don't have sex, because your body really needs like a full year to recover before you get pregnant again. And so that's kind of a protective mechanism that tells your body, like, stay away, like you don't want to mate for another year. But in a relationship, like, that can be like a tense subject, right? And that can be like a fighting point, and that can be something that couples really argue about. And so, like, just having that conversation up front, even before you deliver, before everybody's sleep deprived, to just kind of like be open and have communication about it, I think can go a long ways. Mm-hmm.
Take baths, I guess.
Yeah, baths are great. With bath bombs, I mean, I would put a bunch of soap in the bathtub.
So I wouldn't. I would say probably not for the first 3 weeks. That's going to be when, like, you want everything to scar down and be completely closed. In terms of wounds, if past that 3 week point, I think it'd be fine to take a bath and do a bath bomb. But I would recommend like if you have a shower, like a shower head that comes off, like do a really good rinse afterwards, or maybe after you get out of the bath, put the bath on, like hop in the shower and just rinse thoroughly.
But like just warm water, if you were to just take like a warm water bath after you deliver, I think that can be great. Just like that warmth and the warm water, like that can be super soothing. So I would recommend that for sure.
You can also try, the other thing too, like, so in terms of like fresh injury, you want to think about decreasing swelling. So the way you can do that with heat, especially if there's, like, heat is anti-inflammatory in terms of like flushing fluid through, so it doesn't like sit there and congest. Ice will prevent the arrival of fluid to the area. So we have these really good padsicles, because like we said last time, there will be a significant amount, or 2 times ago, I guess, there's a significant amount of bleeding that happens after delivery. So they have, some brilliant person developed these like pads to catch the blood, and they're ice packs. So you can just like sit on these things, which are delightful. I actually, when I thought I was going to have vaginal delivery, I bought a box of them. And then I gave them to another gal that we work with who thought she was going to have a vaginal delivery, also had a C-section. So somewhere there's a box of these floating around. So if you're really interested, I'm happy to round this up for you. Yeah, you can. Okay, maybe don't take them. That's right, don't take them. Only after delivery if you need them, they come by. Yeah, they're that's a good point. So C-section delivery is very similar, nothing heavier than your infant for just a little bit longer. After the dressing is removed, clean the incision with lukewarm water, no soap or scrubbing. Does everybody do staples here?
No, not always. So they kind of go between, sutures and staples. Yeah. And I can't even tell you that, like, every time Dr. Gallagher does staples, because I feel like they kind of take it more like patient by patient. Yeah, actually. I would say probably like one of the biggest things is just like after you shower, like I wish we could all have a belly that looks just like that. But that may not be the case. And so if you do have a pannus, like if your belly like has a fold, I guess, like a roll where your incision is, to make sure you get that super dry and just keep it dry. And so we put, I mean, even if you could put like a little towel or a little pillowcase or anything there to just keep it dry, because any place that's warm and moist is going to grow bacteria, right? And so just, I mean, once we remove that dressing, it's just open to air until it heals. And so we just want to make sure we keep it really dry.
And, you know, a lot of people, like when folks have a pannus, so they have like the front skin fold. A lot of people will put like baby powder and stuff in there. So don't do that if, with a healing wound. You want that to just, like Megan's saying, just dry. You also don't want to like take a towel and wipe it across. You're thinking like patting. You want to pat that incision. And then I would recommend, I mean, especially if you're in the hospital, just go lay down for a little bit and like nurse your baby, because chances are they're going to be ready. So just let everything totally air dry. You don't have to put, you know, like especially a surgical wound, you don't have to put anything on it. You can just let them dry. Like the wound is called, the wound is completely closed, right? So you have the 2 pieces of skin that have been brought completely back together, and then they've been secured together. So the likelihood of them ripping open is pretty low unless something dramatic happens. But yeah, you just want to make sure it's dry, and you want to make sure, like, you might have like a little bit of oozing of something that comes out of it, but it should be dramatic. And then otherwise you just leave it alone. C-section scars, like where the low transverse scar is, they're below the waistband on most folks. So, but if they're not, if you put it on a pair of pants and you're like, nope. Like I know after my first son, I couldn't wear like normal pants for probably like a good 4 to 5 months. Like it was really tender. With my daughter, I think I was back to normal pants in a couple of months. But just be aware that that might be something that happens. So leggings may be your best friend for the 4th trimester. Bracing with coughing and sneezing. So I noticed this when I had a C-section. I noticed it a lot on the first one and not as much on the second one. But bracing is where you actually physically put your hand over the incision and then cough and sneeze. So again, especially during cold and flu season, if you happen to catch a cold, make sure you can put your hand over the top of it, especially if it's feeling kind of fragile. Same thing, no straining, keep your stool soft. That is extremely important when you've just had your abdomen cut through. And then gentle and easy return to abdominal contractions no earlier than 3 weeks postpartum. There are some really basic things that you can start doing right away. But the abdominal contractions I'm talking about are you're laying in bed and you, like, baby starts crying and you vampire yourself up like a sit-up. So don't do sit-ups for at least, any sort of sit-up for at least 3 weeks afterwards. So no more postpartum recovery, vaginal bleeding for 6 to 10 weeks, medium transitioning to light flow. You're gonna feel like you got hit by a Mack truck. It's just how it feels. I remember I've treated a couple of people within the first 2 weeks following delivery. And this one woman, I remember she came in, like how she had circled, she was like 24 years old, and she had like just circled the entire diagram. Like we have a diagram of body that says, go ahead and circle the area that has your pain, and she just like circled the whole body. And I was like, okay, well, when does this hurt? She's like, all the time. Okay, well, when does this part hurt? All the time. Well, when does this part hurt? All the time. And then 2 weeks later, I was like this miracle worker because she felt so much better and I had done nothing. It's just that first 2 weeks, again, like we were saying, like your body is like adjusting, and one day it stops. So that 2 week period really makes a big difference in terms of just kind of returning to normal. Hair loss, can be profound. It's incredible. You will clog the drain, so get some drain. Night sweats can be impressive as well, especially if you have any sort of like significant swelling towards the end of pregnancy. You can have some, God, my night sweats when I had preeclampsia were, like we'd have to change the sheets in the middle of the night. It was insane. And then they can be pretty minor too, or you may not get night sweats at all. Difficulty activating abdominals for the first 3 to 4 weeks. So it would be normal that like you still don't feel like you have your abs, and again, they were just, your 6-pack was 2 3-packs, and they're working their way back together. So abnormal would be heavy vaginal bleeding, passing clots larger than golf balls. And that's a kind of a general recommendation. If you're continuously passing clots larger than golf balls, that's definitely something concerning. You may notice some really big clots, especially like right off the bat.
So generally after you deliver, we have like these big, huge pads just under you on the bed. And it's pretty normal that we like right after delivery, one of those is fairly well soaked. And then we might put a fresh one under you. And then sometimes we'll chart like dinner plate size bleeding, right? Like we can all envision how big a dinner plate would be. That might be on the pad. But then after like that 2-hour mark where you get up, you go to the bathroom, you pee, you shower, then we would kind of expect you, we give you these nice fancy mesh underwear, and then the big humongous big pads. And I would expect that your bleeding would be contained to those pads after like that 2-hour mark kind of. And those pads are humongous. But if you're filling one of those every hour consistently or bleeding more onto the bed, like that's too much bleeding. And then you'll have kind of the same instructions. Once you go home, if you start bleeding, what you think is heavy, put on a fresh pad. If you've soaked that within an hour, put on a fresh pad. If you're pretty consistently soaking a pad or more per hour, you probably should come back in. But it's not uncommon in that first, 24 hours that you're going to pass a clot that, might be the size of my fist, like pretty big clot. But usually you'll pass a clot and then your bleeding will slow down. And then if you notice like, oh, now my bleeding's picking back up, and then you pass a clot, then it will slow back down again. So just kind of pay attention to that. You also might notice like right after you breastfeed, your bleeding will pick up because while you're breastfeeding, that uterus is contracting, and so it's increasing your bleeding, which is all normal and expected. Please do not come to me in 20 years and say, remember when you taught that class and you said like it's really common to pee or poop yourself after you sneeze after you've had a baby? And I'm going to say, yeah. You're like, it's still happening. Please do not do that, right? So more than 6 weeks, it is not normal, right? Nothing. It is common.
It is common, but it is not normal. Nothing should ever enter or exit your body without your consent, right? General rule for life. So if you are sneezing and peeing and you are 8 weeks out, come see me, right? We will fix it. And it doesn't even have to just be sneezing or peeing. Like some people return to running and they're like, gosh, darn it, like it's 12 weeks, like I'm finally getting back into this. Come see me, right? There is some normal loss. There is some there is some common loss of urine, like some incontinence following whether it's a vaginal or a cesarean delivery. Again, your pelvis is trying to get back to normal. You just had a big process happening in your lower abdomen. So you may, and again, your abs aren't contracting super well. So your ability to really stabilize and coordinate your pelvic floor, that group of muscles on the bottom, could just be really poor. I had a coworker whose sister, she was asking me about her sister, and she said, is it normal to like cough and poop your pants? And I was like, what would ever make you think that pooping your pants is normal when you're in a, well, I think the first thing I asked was, how old is this person? You know, like, okay, if they're 2 maybe, you know. No, they were 32. And so this gal, since she had had her 3 children, would frequently have complete loss of her bowels, right? Let's fix that. Please do not live your life like that, okay? Just because you had a baby does not mean you need to live like this, okay? Don't let anyone tell you different. Don't let all the women that you're saying, like, yeah, I sneeze and I pee, and they're like, oh, because you've had kids. Sure, it's because you've had kids. Nobody needs to be sneezing and peeing, okay? Just, I'll save you all right here. So more than 6 weeks, come see me, right? And that would be common. Like, it is not uncommon for more than 6 weeks to have some incontinence. Just come see me. This is the anxiety, postpartum anxiety, depression that we were talking about. Anything that disturbs your life. My own personal experience with postpartum anxiety, I couldn't sleep, right? Like I was telling you, like you need to sleep, you really do need to sleep and baby sleep. I couldn't sleep. Like I would go try to lay down and my mind would just do this. And so I wound up in this like very bad cycle of fatigue for about 6 months. So anything that's disturbing your life, you find you don't have this nice rhythm, you find that you can't get your mind to slow down, definitely discuss that with somebody. Obviously thoughts of hurting your baby, please recognize that as a postpartum like chemical imbalance, and that's something that can be fixed. That's not normal. That is absolutely not normal. Severe pain, so anything that like is keeping you up at night, anything that is severely limiting the things you do, especially once you're kind of out of that first 2 to 3 week window and everything should be starting to heal, whether it's back pain or pelvic pain or anything like that. And then pain, like we said, pain with intercourse lasting more than 8 weeks. Questions on any of those? Don't be afraid to just jump in if you think so. So available hospital resources, of course we have Megan. We do have a Facebook group that's not super active anymore. I should probably refresh that, but it is called Lacey Milk and Cookies. That's a breastfeeding group we have. We do, like Megan said, she does lactation consults here. We have a really great breastfeeding room. I just went and checked it out yesterday. We have me, I'm the pelvic floor physical therapist. You have your OB or your family practice / pediatrician. We have a person who trains people in infant CPR. So if you haven't taken an infant CPR class, I would totally recommend taking one just as a refresher. I mean, we get CPR every 2 years, and I still did one just to like make sure that I didn't panic in the moment. And car seat safety. So I think that's one of the checkoff things. So if you haven't gotten your car seat installed, it's free. It takes about 15 minutes and super slick. And they're pretty available, so you can usually come down at whatever time works for you. And then, like I said, the kellymom.com, that is a really great website for breastfeeding and breast milk resources. And there's all sorts of Facebook support groups. And I was thinking, as Megan was talking about, all the people that are eliminating all these things out of their diet, if you post something on the Facebook group and you say, it's 2 o'clock in the morning, my baby's really fussy, and they won't go down, they don't have any ideas, they're going to be like, cut out dairy. I swear to God, that is going to be the first thing that they suggest to you. It's dairy. It's dairy. Because you had dairy, it's because you had nuts, it's because you had caffeine. They're going to tell you it's one of those things. I would say use the Facebook groups with a grain of salt, but it is really a good place to find community. Like if you, especially in a pandemic where we're pretty isolated, and however your family is handling that isolation, Facebook can be a really good way to connect with people of the same, going through the same thing. Anybody else have any other good resources that they've found, like as you've been with pregnancy or heard about, that you guys really like? Awesome. Awesome. Great. Okay, Thompson breastfeeding method. Check that out too. I'm not familiar with that. I'll have to look at that. Have you heard of that? Yeah. Nice. And you liked it? Mm-hmm. We bought, Katie, I'm not a reader, so. My house would have to be kind of quiet. There you go, yeah. One thing that Dr. Gallagher will have you watch here is, the happiest baby on the block. Have you guys ever heard of the book, The Happiest Baby on the Block? So there's also a video. So you have to watch the video to be able to leave the hospital with your baby. I actually bought there's a Happiest Baby Guide to Sleep, and then there's a Happiest Toddler on the Block. Like, I watched that video, and then, granted, we're all like on our second kid, and my husband and I sat down, we're like, all right, here we go, purple crying video, let's go, let's roll. And we watched this Happiest Baby on the Block video, and my husband, like, gets over it, and we're like silent for a second. My husband turns to me, he's like, why did no one have us watch that last time? He was just like, this was the greatest thing we've ever watched. So we bought all the books. And I like them because they're easy to reference. Like, you could just quickly look it up. So that was something I really liked too. And you guys will get to watch The Happiest Baby on the Block.
If Dr. Gallagher's your doctor, he will like quiz you on it before you go home. So make sure you pay attention.
Right.
Yeah. But really, I mean, so The Happiest Baby on the Block is a pediatrician, and he started practicing like in the 1980s. And he said that, people would come in for their well child checks, and these babies would be crying for hours on end. But in the pediatrician's literature in the United States, normal was considered a screaming baby for 3 hours continuously was considered normal in the United States, right? So this, like, you can just imagine this sleep-deprived mom, like, drags herself into the office with this screaming baby, and it's like, this baby's been screaming for 2 hours and 45 minutes, and they, like, assure you that that's normal because they have been screaming for less than 3 hours. Like, you would lose your mind. And so he started, like, researching other cultures around the world and just, like, okay, 3 hours of screaming would put anybody in, like, the insane asylum. But yet we're telling parents that that's normal in the United States. So, like, what do other cultures tell their moms? And he found some cultures in the world that, like, a baby crying for longer than 1 minute was fairly unacceptable. And so then he looked at, like, well, what do they do different than what we do? And so that's where he came up with this method called the 5 S's. And he really believes that babies have a calming reflex. And so if you basically strike the right nerve, you can instantly calm your baby. So the trick is, how do you do it just perfectly to calm your baby? And so he came up with these 5 S's. So the first one is swaddling, and that's like the most important one. Like, to get any of the rest of them to work, you must swaddle first. So you swaddle your baby. I don't have a baby to show you, but right, your baby's swaddled tight, and not like loosey-goosey, their arm came out, but like tight, like they're squished in your uterus still tight. So you swaddle them tight. Then the next is side lying, right? So your baby's like laying in your arm like a football, right? They're on their side with maybe an arm and a leg. They're still swaddled, but they're side lying. So swaddled, side lying, shushing. So when the baby is in your stomach, they say the amount of noise that they're used to is comparable to a hairdryer right next to their face, right? So when he shows you how to shush this baby, he says you have to shush louder than they're crying. And so he's holding them, which parents always think is like so rude and disruptive, but really it really helps. Like, it's great. So they're swaddled, they're side lying, they're shushing, then swaying, right? So maybe you're swaying back and forth, or I shouldn't say shaking, but it's like jiggling as your.
If you had Jell-O on a plate and you just wanted to make it wiggle,
yeah,
like that's the.
Like, yeah. We're not instructing you to shake your baby, right? But
it's like a jiggle.
Giving them a little jiggle, but that doesn't start with an S. And then the last thing is sucking. So whether that be on a nipple, on a pacifier, on your finger, those are the 5 S's. And it's pretty amazing. Like if you do those, and most often you don't even have to get through all 5 of them, and your baby is out. But you have to start with the swaddle. So, a couple of years ago, when I was a better nurse, we were doing a breastfeeding support group. And so these moms would come in with their babies every Tuesday. And so this one mom was like dragging herself in the door, and she was just like, I'm not sleeping at all. And so we were all like, well, like, are you swaddling? No, my daughter hates the swaddle, which parents tell me that all the time. Like, their newborn is like 3 days old. And I'm like, are you swaddling? No, they hate the swaddle. Really? They're 3 days old. They don't get an opinion. And so we all told her, like, you have to go home and swaddle this baby. So she comes back the next week and she's like looking much better. And we said, how's the swaddling going? And so she took the baby the first night and she swaddled her up tight. And she like instantly just went quiet. So she thought that she had swaddled her too tight and she had passed out. So she like jerked the swaddle off of her and she woke up and started screaming. And then she was assured that everything was okay. So then she swaddled her back tight again and she just right back to sleep again. And it was like that easy. Now I would say most babies aren't like quite that easy.
It's not that magical, yeah.
But I mean, like you swaddle them and then like you do a little side lying or you just, you know, shush them or whatever and asleep they go. I mean, oh my gosh, I really think it's the secret to success.
Oh God, yeah.
And we got, so with our first child, he cried a lot. Whether that was because we were first time parents or because he was just a crier, I don't know. But somebody sent us this gift. It was called the Miracle Blanket, and it was a swaddle blanket. In the mail, it arrived when he was like a week old, and I just thought like what a chintzy baby gift. Like who sends you a swaddle blanket for a baby gift? No, it was the best baby gift we ever received. Like that thing, oh my gosh, like I don't care how dirty it was, like he was wearing it every night. So I've since bought many more.
There's a technique with swaddling, and they'll show you in this video, right? So we'll do a quick refresher, and then you'll get more. But I would say between now and the time you deliver, dads especially become swaddle experts, right? Because babies are swaddle ninjas. Like you're like nailed it, and then all of a sudden this like little arm wiggles out, and then they're back awake, right? So like
because like one dad said, like it's terrible that like their arm scares them to death, but like they can be sleeping soundly, and then this arm emerges, and they slap themselves on the face, and then they wake up, and then they're crying, and then the whole process starts all over again. So the amount of sleep that you get as a parent is determined by how good of a swaddler you are.
And this is how it starts, right? So here's your swaddle blanket. I prefer blanket. We have become swaddle masters in our house, and then we have to remind ourselves every time we have new kids. But you're just square swaddle, right? And you're gonna fold down a corner, and then this is gonna be baby, and you put it right at the level of their ears, right? And then you have the rest of your baby here. And then you're going to fold this down. And I think where a lot of people get messed up is they're too gentle here, and you want what's called scapular depression. So you want to pull their shoulders, like you want their shoulders down, right? So you're going to take this and fold it down and across their body this way and tuck it underneath. And then you're going to pull, so this corner goes down, and we do like a double fold. So this corner comes down, and then we take this one and wrap it around baby there. Take this one and bring it up, down, and around, right? Not hard, watch lots of YouTube videos, that'll save your life. But the Miracle Blanket, because I got one after teaching this class with Megan, and what it does is it holds their arms right here, because you have a little piece of fabric that goes there, and a little piece of fabric that goes there, and then they lay on it, and you stick their feet in this little pocket, and then they can't move. I used it till Lucille was like, it's like a straight jacket, and they're gonna wiggle, and then you get this tight outer swaddle around them, and
down not going anywhere.
Yeah. Yeah. My son was a swaddle ninja, and I think that's why I took place over 7 months. Yeah, just a swaddle breaker.
Well, and my first son, Cooper, he was a March baby. So like by July or something, I was like, well, it's probably too hot for a swaddle. So we didn't swaddle him anymore. That was a terrible mistake. The next one was a May baby, and I swaddled him like, until he was 9 months old, which is like maybe too long, but we were getting good sleep, so we didn't mess with it.
And the pediatrician on the video will tell you like swaddle them until they're done. My daughter still gets swaddled at daycare for now.
I think once they start turning over, like now, like if they're swaddled but they'll stay on their back, that's fine. But you don't necessarily want them to be swaddled and flipping over onto their belly, because then they have no arm to like help free their head, if that makes sense, you know what I mean? Like, yeah. So, but if they are like content to lay their swaddled and be on their back, then that's fine. But if they, want to like take off, still swaddle, probably you should lose the swaddle.
Yeah, I think the
But-
best recommendation we can make is that miracle blanket, like, literally, they're like $25, $30 on Amazon, like, get yourself a couple of those. And then the outside swaddle can be whatever you want. Like, I didn't use any of the muslin ones with my son, because I didn't feel like they stuck enough, so we had, like, they were like baby blankets that my mom used on us when we were kids. But with my daughter, since we had the miracle blanket, then I would do a muslin swaddle over the top. So play around with what you like. If your friend who has an infant baby, like, check out what they have and maybe try swaddling. I know this diagram, you're probably like, don't understand that diagram. And that's fine, but like I said, watch a lot of YouTube videos because it'll help you. But I think the biggest key is you start here. Like, you want to start at the baby's ears, because that's what helps get that shoulder down and prevent them from wiggling it back up.
And in the hospital, like, we swaddle these babies like 100 times a day, right? And so, like, just be active in that. Like, get over there and be like, okay, I need to know how to do this. Like, show me how to do this. Teach me how to do this. You know, because it's great and wonderful if the nurse does it for you the whole time, and then you go home and you're like, nothing. Like,
And everybody's a little bit different too. There's like slightly different techniques. You guys probably think we're crazy because we've now spent like 7 minutes talking about swaddling, but it will save your life. Yeah. So, and you know, like, I was talking to a friend of mine who's pregnant, and she was like, I get so much recommendations on like things I should buy, things I shouldn't buy, like what I should put on the registry, what I shouldn't put on the registry. And I think when it comes down to it, you find out what works for your family. I think I have bought one of every single kind of swaddle that has popped up on my social media. Like, I've at least tried it. And so now we have a system that works for us, that my husband and I know how to use, that's easy for us. You guys will find the same thing. But I would say if you can follow like these 5 S's and then be a really good swaddler, I think whatever you find that works for you will be really good.
Have you guys heard of the doctor, like, Hamilton or whatnot, the hold?
the hold.
The hold, yeah.
No, you gotta tell me more.
Dr. Robert Hamilton demonstrates the hold. It's and, like, on his chest and leaning up for it, he can stop crying. I was watching.
Huh.
Yeah.
I mean, that sounds like are they swaddled, or are you just like?
No, like, yeah, like, really holding their hands into the chest like this, like, thing, and like.
So, like, one of the ways that they describe, like, the side lying position is just like, so just imagine, like, if somebody was holding you in the air with your back facing the ground versus your stomach facing the ground, like, it's more comforting for most of us to be facing the ground like this, right? Because you at least have the sensation that you could catch yourself or whatever, as opposed to, like, if you're suspended, you know, laying on your back, like, you have, you know, and so, like, even though an infant's not going to catch themselves no matter what position they're in, I mean, you have to wonder if they're, like, you know, because it's similar, like, you know, all babies are born, and we go set them on the scale, and we, like, pick them up and set them on the scale with their arms and their legs in the air, and they all scream and kick their legs like this, right? But if you pick them up and you set them down on the scale with their belly on the scale, they don't cry. Well, I mean, they're only there for like 10 seconds while we just weigh them. You know, but it is interesting, like the sideline position, like they're kind of facing down towards the ground.
Yeah, it's like 3/4.
Position, like, you know, you're facing them down, like, I don't know, like, just, is there something about our, you know, just evolutionary, I don't know, just something about the way we are that, like, at least being facing down gives you more security. I don't know.
Yeah.
But, like, that's, I mean, babies on a scale do that. Babies in the, you know, the 5 S's, they tend to soothe more in that position.
Give it a try. Yep. And of course, like, the biggest thing with a newborn too is like protect their head. So I would say if this is like a, you know, couple weeks old, like baby doesn't have good control of their head, and you'll see, like, as they get older, like you'll see that head control develop. Like, you go to lean them forward and their head stays up as opposed to rocks forward. But just like you would with like CPR, you know, you're gonna like hold their chin like this. You're like, so they can still breathe, but their mouth is open. You know, their mouth and nose are clear, and then you've got like their hands pinned under your arm or something. Yeah, report back. Let us know how it goes. Okay, so postpartum exercise. So everyone wants to get back to their pre-baby body, right? That's always the goal. So benefits of postpartum postpartum exercise reduces fatigue and increases vigor, which means just energy and like ability, like both mental and physical energy, improves your mood states and mental acuity. So again, like we said, some people for postpartum anxiety and depression, they've just got to have that physical discharge of that energy. Improves fitness, promotes return to pre-pregnancy weight, decreases risk for developing future chronic health conditions. I guess we'll talk about this in the next slide, but there are many women who never go back to their pre-pregnancy weight. Like they have one baby and then they get busy taking care of that baby. Then they have another baby taking care of two babies, and on and on and on. So definitely something to think about. Provides important mom self-care time and social interaction. Absolutely, right? So, again, like we're focusing on your body and your body's recovering as well as your baby and your baby's growing development. So postpartum weight retention is related to inadequate physical activity, poor nutrition, and sometimes excessive weight gain during pregnancy. So I love this because I know women, like we have this whole thing like, oh, how much do you weigh this week? Oh, how much do you weigh that week? And if that's not enough to drive a woman psychotic, or really any person psychotic, I don't know what is. But what's nice to know that you're like, well, here we go. I gained 50 pounds in pregnancy, got to really work that off. Postpartum weight retention generally is not related to that, right? Because you went through this huge hormonal experience and you gained that weight with that. It has more to do with the way you treat your body afterwards in terms of that postpartum weight retention. Nearly 20% of women are more than 11 pounds heavier 6 to 18 months after delivery. And of course, like we all know, like the load that excess weight can put on your body in terms of like cardiac and respiratory and organ function. Our bodies just, there's a natural homeostasis level for our bodies. And if you have an excess 25 pounds on that, it's just a harder load on your heart and your liver and your kidneys and all these, and your respiratory system and all these systems that are working to keep you alive and functioning well. You also may find that your energy is just lower. I know after my daughter was born, I went back to coaching volleyball. I went to like chase after a ball, and it was like running through mud, and I was a marionette. Like I had nothing holding my joints together and felt so sluggish. So being able to improve that over time can be really important and help you feel better. So start slow, right? So don't go straight back into HIIT training or lots of jumping activity. 20 to 30 minutes of gentle plyometrics, low impact cardio or yoga. So think like an elliptical versus running on a treadmill. Think like being on a bike, like on a lower setting as opposed to like doing a spin class. Initial focus on, so one thing that you could do, this is very simple and I think very realistic for most people, increasing, like if you have most people have watches or pedometers on their phone, if you can increase that 500 to 1,000 steps every week, that would be a really great way to improve it. Avoid the running, jumping, heavy lifting for at least 6 weeks. And then I would also recommend avoiding split leg, abdominal, high impact and twisting exercises initially. So, again, like we're kind of in this weird time of year and also time of existence in terms of the pandemic. So there aren't a whole lot of like big sporting events going on that you'd be participating in, but still something to think about. Making sure you stay hydrated. A lot of women find that they get a big dip in breast milk after they start exercising, but I think it mostly has to do with hydration. So making sure you're staying hydrated and then warm up and cool down, because again, your muscles have been chasing your body for the last 10 months. So make sure you slowly work your way in and then slowly work your way out of exercise. Should I say when to start this? So this is like a 6 to 8 weeks postpartum, if cleared, 5-minute walk with a stroller, right? So if your doctor says, okay, you're good to go back to exercise, and high impact exercise, 10 minutes of plyometrics, squat, heel raises, lat pull downs, bridges, 10 minutes of abdominals, modified plank on an elevated surface, the diastasis friction, which I've got an exercise handout for, so I'll show you, a supine march, which would be like laying on your back and holding your abs in and then marching your feet, and then modified push-ups, 5 minutes of stretching, right? Like this may be it for a little while. Most women, I think, like, if you can get through this first couple of weeks with maybe baby's starting to like develop a little more of a schedule. People are like, okay, let's get this baby body back, and there's like a huge like caloric restriction, and then as like massive exercise increase, go easier on your body, right? Like I think the best evidence shows that if you can take that 4th trimester period and eat things that are healing for your body, so foods both hot in temperature and hot in flavor, are very healing. Like that is, when we look at other countries, like in Mexican culture, they make this special soup that is like a hot soup and hot and spicy soup. So that, think about that way. Like I know for me, we made, it was like lots of Italian and Mexican dishes. Like that's what we made, right? We got like lots of those warm flavors and warm meals. And then making sure you eat enough calories. So really for like that first 12 weeks, eat a well-balanced diet. Like you don't have to overload it on one thing or another. But you don't have to worry, don't like be like, oh God, I can only drink the low fat, whatever. Like you don't have to worry about that in terms of returning to that postpartum, in terms of returning to your pre-baby body, right? Give yourself the 4th trimester because your body's coming out of it. And if you can allow your body to slowly come out of it, you'll actually find that you get those results better and faster and feeling better in doing it than if you try to start pushing that at 2 weeks out. Does that make sense? So this is just an example, and this is something, too, if you are not an exerciser, but you're like, you know what, I want to do this, that's a great reason to come see me for a couple visits too. We can help get you started. Or let's say you start exercising and it doesn't feel good, that's a great reason to come to physical therapy for a couple of visits, and we can get you set on a beginning program and with progression. So that's something we can work on as well. So they have found that high-intensity exercise, so like this woman playing soccer or like marathon runners can increase lactate levels in milk. So you could think about breastfeeding or pumping right before you exercise. The amount, just like with stuff you eat, it's not significant, right? Unless you're like doing an Ironman, that would be something probably to reconsider breastfeeding right afterwards. But more has to do with comfort than milk content, if that makes sense. Like it is not comfortable, I speak from experience, to like play volleyball and like have full breath. Like there's just lots of things bouncing and it's not in a good way. So and then like diving is like, if anybody plays volleyball, like trying to dive when you like need to pump or breastfeed is terrible. So and then staying hydrated to drink satisfy thirst during your exercise.
I saw this picture of this lady. I was at a lactation course and they showed a picture. It was one of their coworkers actually, and the picture was taken from like kind of up a hill looking down, and you could just see like her back. And so there's this lady sitting on this hillside, kind of hunched over like this, and you can see 2 sets of feet on either side of her. And so she actually had a set of twins that were like almost a year old, I think, and she was sitting on this hillside holding her babies, nursing each baby. So there's a set of feet coming out on either side. And she just had on like a pair of running shorts and a sports bra, and she had just finished an Ironman. And so I just think like that's like amazing. Like in 18 months time, you got pregnant, you grew 2 babies, you birthed 2 babies, you breastfed 2 babies, and trained for an Ironman. Like that is like amazing that the human body can do that, I think. And you certainly like do not have to do that to, I mean, your body is amazing just for growing a baby and birthing a baby and feeding a baby. But I just think like, holy smokes, the human body is truly amazing.
And I think that the biggest piece of advice I can offer physically is to, is it not working? It should sit, yeah.
Oh, there you go.
There you go, yep, keep it up. And now, yeah, there you go. There you go. The biggest piece of advice I can offer you is don't start it too early, right? Don't panic. It is very easy to look at your body and be like, oh my gosh, what just happened to that? But don't let that drive pushing your body too quickly before it's like had adequate time to kind of come back to normal. So nutritional recommendations, not that different than a regular healthy diet, except for adding maybe a little bit more milk products. And that really just, these are recommendations from nutritionists based on fat and calorie content. Really, the amount of energy needed by lactating mothers is only about 500 calories more than you would eat normally. So let's say you're like looking to drop some weight, you could eat let's say maybe a slight caloric deficit than what, like maybe 100, 200 calories less than what you would normally eat, because you're still going to be burning an additional 500 calories, right? So if you, like, let's say your basic metabolic rate, let's say is 1,500 calories. So that means every day you're breastfeeding, your basic metabolic rate is now 2,000 calories. So calories in, calories out, you would assume that if you ate 2,000 calories and you were breastfeeding, you'd stay at the same weight, right? But we aren't growing a human anymore. And like we said, there's like this insatiable like thirst and hunger for a little while, while you're breastfeeding kind of normalizes. But then if you go back to eating your normal, 1,500, 1,600 calorie diet, you're at a 500 calorie deficit every single day. So don't worry about like majorly cutting back on what you're eating in terms of returning. Like I had a girlfriend who she uses breastfeeding like as her return to pre-baby body. That's not a guarantee. I'm a person who I'm pretty sure breastfeeding like just adds weight to my body. So that's not something that works for me. And and that's not uncommon, right? So some people will say, oh, I breastfed and within 2 weeks I was back to my pre-baby weight. Congratulations to them, right? So it's okay to not be in that same window. All right, so here, you guys, this is it. This is the last bit of wisdom that we have to impart on you from our own experiences in both our professional backgrounds. I am available at my phone, so you're welcome to like take a picture of this information if you'd like, and feel free to email us or call us with any questions. And Megan will put her phone number up here. But other than that, that's all we've got. If you have, or what other questions have come up, I will definitely make sure to draw the poop charts everyone can see it before you leave. It's important. I know, everybody's waiting. Sorry? Have you? Yeah, come see me. When did you say you see Gallagher? Yeah, ask him, or you could probably, is Dr. Tan here this week?
She was, but I heard she's leaving tomorrow, so.
So you could probably call her, or she's leaving tomorrow, like she's here tomorrow and then gone.
I don't think she's here tomorrow. He was here today.
Oh,
I
okay.
think you're right. Yeah.
I would say when you go see Dr. Gallagher, I just ask for a referral. What insurance do you have? You might actually be able to just self-refer. Call me at that number tomorrow in the morning, and I will find out for you. Yeah, absolutely. Come see me, and then we can like make sure you're good to go before labor and delivery. And if not, like if we need to like modify positioning for labor and delivery for you, we'll do that too. What other questions or thoughts or comments? You guys totally got this. You guys are gonna be great. You're gonna be great. I'm very excited. We're both very excited for all of you.
Mothers, hey, you guys are warriors. Watching that video, it still has me shook.
Just wait till it's real life. You're gonna do great.
I can't wait to see how much this baby weighs.
I know.
Last week he was 7 pounds already. Yeah. They always ask me, oh, do you have gestational diabetes? I'm like, nope. Like baby. I truly believe in the body's ability.
Oh, yeah,
Right.
Like, I'm so excited for you.
Yeah.
I hope I'm there.
I hope you're there too. Look at his main word.
So the other thing too, not very many people take me up on it, but the other thing too is if you are like in labor and stalling or struggling, don't be afraid to like have your nurse have me come down either, because I'm happy to come down. I mean, I feel like I am completely confident in especially your labor and delivery partner's ability to like help coach you through some of the stuff we talked about, to help you find what you need, and you recognizing what your own body needs. I think you guys are going to do great. If you find that you've hit a wall and you really need some help, don't be afraid to call, and I can just like run down and give you some advice, talk you through if you're struggling with one thing or another. If you have hip pain that all of a sudden is coming out of nowhere and you can't get into positions that you want to get into, call me down and I'll let them help you. 100%. Feel free. What do I do next? Do the next one. Let's go to the next one. Feet together. Knees apart. Yeah. Totally. Yeah.
And especially after you deliver, I mean, I thought for myself anyways, I thought like, oh my gosh, breastfeeding is supposed to be like the most natural thing in the world. Like, you know, all these animals out there do it. Like, this should be a piece of cake. This shouldn't be a big deal. You know what I mean? And it is hard. And so, like, I think that breastfeeding cultures do a great job of like, you know, like everybody in the family breastfeeds. So like you have a baby and your mom and your aunt and your sister and your grandma are all like there helping you. But in the United States, like we've, you know, everybody was breastfeeding and then formula became popular in like the 50s. And so then so many people, like we lost like a couple generations of breastfeeding because everybody was just formula feeding. So now I feel like it's a lost art and we're trying to pick it back up again. And so, like, yeah, you might have some friends, but you might also have plenty of moms and grandmas that are like, just go ahead and bottle feed, or, you know, or maybe nobody in your family has breastfed before. And so it's kind of like, you know, nobody really has any tangible advice for you. And that can be hard, I think.
And looking back on it now, there is nothing as funny as like your dad or one of the grandfathers in the room when you go to breastfeed. There's nothing. This is my own personal thing that I just laugh at, but there's nothing like watching them try to figure out where to go. As soon as you start breastfeeding, they're like, I need to, I'm leaving. And then like out the door they go. Like when my son was born, we were in the NICU. Oh, my son was in the NICU, so I had to pump, right? Like I'm like on this like rigid pumping schedule. And my dad's sitting there with me because nobody wants to leave me alone. And the nurse comes in and she's like, okay, here's, you know, time to start pumping. And my dad's like, and like just all of a sudden was out the door, and I was like, well, okay. Here we go. Hi. Yeah, he was very nervous. So that'll happen too.
I mean, it is the coolest experience though, coming up on you guys. And I mean, oh gosh, just the other day I delivered this couple, and I mean that baby was just laying on mom's chest, and that is my favorite time, like right after they're born and that baby is just right there on your chest. And I mean, you never get that time back. And I just can't even like pry myself out of the room. Like I just like stand there and stare at them. Because it's such a cool time. And it's, you know, like I can remember that with all my kids, and oh my gosh, like such special times with your babies. And I mean, right around the corner. I mean, it's almost
literally right around the corner.
1 week away.
You think 1 week from today?
No.
Election day?
Oh, that's okay. That could break your water. When's the dip in barometric pressure? When's that coming?
We called this weekend and I started feeling more pressure.
Oh, you have? Well, drink some castor oil. Did we finish that story about the castor oil?
No.
Okay, so.
But you said never again, so.
Well, go ahead.
You're gonna poop your brains out.
Oh, so castor oil, I mean, I don't know what castor oil is used for, aside from like, I just remember I tried to find it at Safeway and I couldn't find it at Safeway, and so then I had to go to Howard's and I found it at Howard's. I mean, so I guess like it's FDA approved use is just like a laxative, I guess. Is that, do you know, Annika? I mean, I don't know what other thing you use it for.
I've had
Anyways, it's like, it's oil, it's clear, it reminds me of Caro syrup, like, so.
It's very thick.
It doesn't smell and it doesn't really taste, but it's like thick, like Caro syrup, like, right? So it like, kind of like glugs out of the bottle. And so I think you were supposed to drink like 4 ounces of it. And so I was like 4 days past my due date. So I came to town, got the groceries, got the castor oil, went home, and I drank it. And I drank it at like 11 o'clock in the morning. And then by 1 o'clock, I laid down, took a nap, woke up at 1 o'clock, and I was like, oh, like, I don't think this is doing anything. So basically what it does is it causes like such intense diarrhea that it irritates your uterus to the point that it goes into labor, that it starts contracting with the hope that it will put you into labor. So, I mean, Dr. Gallagher usually says you have diarrhea by 3 hours, and by 4 or 5 hours, you're contracting. And I would say I had diarrhea by 2 hours, but by 3 hours, I was contracting every 3 minutes. And then I contracted, and they just kept getting stronger, and I just kept walking around. Then I eventually got in the bathtub. And then when my husband got home that night, we came into town, and my water broke, like walking across the parking lot. And then I delivered not until 5 in the morning, but, I mean, so he tells his patients to do it, like, he tells all his patients to do it. So he says you can either drink it straight, which is what I did, and all I can remember is like this oil, like a slug going down my throat, slow as a turtle. So that's the part that I just like can never do again. So you can drink it straight, you can mix it in like 8 ounces of orange juice and drink it, or you can blend it up in a milkshake. That's his instruction. But he said, like, in his own little research experiment of, you know, like the number of patients that have done it, about 33% of them go into labor. So it works for like a third of them. And I was like, heck, what do you have to lose? Like a little diarrhea is like not a big deal.
Well, it's not like it's 2-to-1, like you really don't want to have that happen during labor, so.
Right. Clean yourself out and have a baby. And he always tells me that he has never, so he is a big believer in like trying everything that you put your patients through, like, you know, so like your old lady, you know, like you feed them Ensure, so like he drank Ensure to see if he would like it, and he's like tasted like Ensure versus Glucerna versus, you know, he's like tasted all these things to see how bad they really are. And so one of the things that he always says, like, yeah, one of these days I'm gonna drink castor oil just to see how it is, but I just haven't had time for diarrhea lately, so.
Bring it in on Fridays in my appointment, I'll be like, I'll do it if you do it.
So I just remembered that I found this, but there's a website that puts together reviews on different things. So she actually did a podcast on natural labor induction with using castor oil. The castor oil is a Oleum palmae Christi, comes from the seeds of the Rhynchius communis plant. We don't care about that. It's a very powerful laxative, often administered by mouth to rats to induce diarrhea in order to study the anti-diarrheal effects of a potential drug. So they'll give the rats diarrhea with castor oil and then try to give them other drugs to stop it. So that's what they use it. Reports dating back to ancient Egypt have suggested the use of castor oil to stimulate labor. The review included 3 trials that studied a total of 223 pregnant women at term who received a single 60 ml oral dose of castor oil, which is only 2 ounces of castor oil. One of these randomized control trials took place in New York, and it was 100 pregnant people total. Women who took castor oil had a significantly increased chance of starting labor in 24 hours compared to the group that received no treatment. In fact, about 58% of women who took castor oil began active labor within 24 hours, compared to only 4% of those who did not receive any treatment. However, 100% of women who took the castor oil reported nausea compared to 0% of the women in the control group, which makes sense.
No, I wouldn't say that I had nausea, gagged and felt like I was gonna throw up just when I drank it, because it was like, down my throat.
Flashbacks. I must have all my grandma put down my throat.
Oh my God.
Mm.
I remember. Yeah, it was.
But once I got through that, then I wasn't nauseated.
So also the mean Bishop score, which we use to measure cervical ripening, also increased in the castor oil group. So like that, those 3 numbers.
How dilated or effaced your cervix is.
So that increased in the castor oil group. And the third study in the review was a randomized control trial in Israel, which is a good level of study. It included 80 pregnant women. The odds of entering active labor within 12 hours was 3 times higher in the castor oil group, but there were no differences between the groups with regard to C-section rate, meconium, stained fluid, Apgar scores, or instrumental deliveries. So it's not going to change your delivery, but per these studies, and they concluded that castor oil is safe and effective for induction in labor in post-date pregnancies.
So Saturday night, drink your castor oil.
Well, Annie has trick-or-treat candy.
Okay.
Ideal.
Saturday night, drink the castor oil, take a long walk, hand out some Halloween candy.
Go take all the kids trick-or-treating.
Then Sunday morning, castor oil, have a baby.
Hey.
here's another thing interesting about castor oil. There's a specific component that they found induced contractions in both the intestines and the uterine muscles of the rats that they were studying. And they found that the strips of uterine tissue from human were much more likely to, they did a study with pregnant uterine tissue from humans, and they found that those strips of uterine tissue were much more likely to have contractile activity or have contractions when exposed to castor oil.
I mean, when I drank it twice with Calder, I contracted a ton, and thought that I was like gonna go into labor, but then after like 8 or 12 hours, it would just kind of start to peter out. But I mean, ended up being, you know, a Pitocin induction at 41 and a half weeks, so I'm not sure that anything was really gonna dart him out of my uterus.
Is like super spicy hot food. I've heard that as well.
I mean, I've heard that as an old wives' tale, I don't know.
I had a friend that got her membrane stripped, and that put her into labor.
Yeah.
And she was like, oh, all my friends already did it, and it didn't put any of them into labor. I'll go for it.
I think they stripped my membranes with Cooper. And then, like, I contracted a lot and had a lot of, like, uterine irritability, I would say, for, like, the next 3 days. But, you know, so, like, whether stripping my membranes kind of started the process, and then the castor oil tipped it over the edge, or I don't know.
There's, if you guys are
My
interested.
sister, like, I texted her, and I was like, I doing castor oil, and she's like, what is that? Like, what is that? I don't think it, like, gives you, like, such terrible diarrhea that it puts you into labor. And she was like, aren't we living in the 20th century? Like, is there no better way to have a baby than that?
If you guys are interested, I mean, because some of these things, like the spicy foods, like they're just things that you hear. If you go to, if you look up evidence, birth, they have like some really easy to read, that's where I got that information. That's really easy to read articles. Make sure you get the poop chart in that picture too.
Oh my gosh.
Yeah. They have some really good, easy to read articles talking about a lot of these different things in terms of like safety and I should add, like in the castor oil one, they don't, like, the studies aren't good enough to be like, oh yeah, it's totally safe. Like, so they don't have enough data to be like, oh, we did it in 5,000 people and nobody got sick. You know, they only studied a couple hundred women, so that's the caveat with those studies. But yeah, I mean, you know, but none of them died. No, there were no reports of death. Right. Yeah, so, but if you're interested, I mean, they talk about like red raspberry leaf tea and using primrose oil and sex and acupuncture. Anyway, there's like a whole handful of things. It's right on the inside, so you want your posterior tibial nerve. So if you've heard of that, if you go to get a massage, the students will be like, oh, you know, I'm not gonna work the inside of your ankle. But the inside of your ankle, you go to inside of your ankle bone and right on the back of that, that's where your posterior. We'll do that on Saturday. And that's, you can do like pressure points with that, or like a rub. It feels kind of terrible, but you like rub up the inside with this little muscle, and that's where the posterior tibial nerve goes. And that goes to help. Cool. So, maybe that's called the floor. You should have heard Bruce. Oh, yeah. That is complicated. Like, we'll call you an ambulance. We're like, please don't do that. All right, you guys. This is all we've got for you. So you're welcome to stick around and ask us some more questions. I put the postpartum exercise sheet right there from the email list. I will make sure you email it too.
I mean, you called the stool chart, but I don't know.
Oh, well, we didn't describe it. Oh, thank you for bringing your attention back to that. Okay. So number one, these are like deer poop. So this is just Anniken's favorite chart. That's all you need to know. So this is constipated. So this is actually kind of interesting because I'll have a lot of patients that come to me and they're like, I'm constipated. And they're not constipated, they just can't poop on demand. Because constipation is like deer poop. Like they're hard, they're painful, like they're just coming out in tiny little chunks and they're like little rocks. So you like poop and then it's like little pebbles down in there. And then number 7 is diarrhea. This is straight. I'm going to try to like draw like little raindrops, but this is not like raindrops. So oh, no, I never spelled diarrhea. Okay, you're not being graded on it. Okay, we'll do that. So a bristle type, so this
this is constipated, that is very slow guts, like your guts should move like, kind of like a worm, like they kind of like massage your stool, the bolus of food, which becomes stool as it goes through. So number 2 is like deer poops clumped together, so they're wet enough that they stick together, but that's about it. Number 3 is like if it's been a couple days and you haven't pooped, it's like that really formed stool that has like cracks on the surface. If you guys Google Bristol stool chart, there's one that even has like personalities associated with all these. 4 is perfect. You want a number 4. It is the consistency of an overripe banana, so it's like squishy and soft and easy to pass, right? 5 is like,
This is why Annika loves Dr. Gallagher so much, because he also really loves food.
yes, we both love food. So 5 is like, it's like this same, it'd be like oatmeal almost, like it's sticking together, but it's pretty darn soft. 5 or 6 is more like when you leave the cereal in the milk for too long, and then it's very loosely formed, but like maybe tiny little soft clumps, and then diarrhea is the straight water. Yep. So some people they go 1, 7, 1, 7, 1, 7, and that's not good. So you're looking for like this 3, 4, 5 range. That 4 is ideal, but 3, 4, 5 is a good place to live. I know.
So why is it not good to have 1 and a 7 every day?
So that's a constipation diarrhea cycle. So what's happening is you are not moving stool through your intestines fast enough. And so what happens is you get these deer poops that block everything, and you end up having malnutrition, so you don't absorb well. It causes you to be dehydrated because you get blocked, and then usually you get this, you can actually like override the reflex of your rectum in terms of pooping. Like in little kids that get constipation, so it's called encopresis, and what they'll do is they'll get this like stool that's blocking it, and then they start having like this like fluid leakage around. So like there's this block, like picture like a river, and there's a rock in the middle, and then the water's like flowing around it, so you get the diarrhea that like comes around it, and what it does is it can stretch out your rectum so much that you like can't get that normal evacuation reflex to poop. So you don't want to have deer poop, because they can cause hemorrhoids and tearing and fissures and all sorts of things. But what typically happens is this followed by this, and then your body just ejects everything for a few days, and then you don't have anything for maybe 7 or 8 days, and then you're back to this. So and it's poor, like I said, poor absorption. You're not getting enough water. You're not getting enough nutrients out of it. Your gut flora are all messed up. So here, I mean, really, even a 2 and a 6 are better than a 1 and a 7. So if you live, if anybody is living in this 1-7 cycle, yeah, constipation is my favorite thing.
I took care of this one girl in the hospital that I worked prior to this. I floated to a pediatric floor, and this gal was like maybe 8, and her diagnosis was poop 40, which I was like, is that a diagnosis? Like, is there a CPT code for that? And the nurses were like, oh yeah, that's a diagnosis. And she like hadn't pooped for, I don't know, like 3 or 4 months when she was admitted to the peds floor. And she looked like, she was 8, but she looked like she was 9 months pregnant. And I think she lost like 21 pounds when they finally got all the poop out of her. But well, so they gave her Go Lightly, which is like a, I don't know if it's a drink that we give people before like a like before colonoscopy. And so they just like had her drink that. She was in the hospital for a lot of days. But the poor thing, like they had like the disposable chucks down over the entire floor. She was a kid, so she like, couldn't really like hold still that good. But it was like every single time that she stood up from the commode, it just like kept running out of her, like the boulder in the river. I mean, holy smokes! Like I'm sure your intestines never go back to normal after that. That's not normal.
Maybe when you're 8. I treated a woman one time who she had a hysterectomy, and if you guys want to leave, you can. We're totally like off topic. Oh yeah, no worries.
We probably don't need to do this anymore either. Do you want to hit stop share and then you can
turn this thing off? I treated this woman one time who had a hysterectomy, and so this is something to consider if you end up